Hello everyone, welcome to a very important session on how to read or how to approach pathology for your theory or prof exams. See, we have two ways in which we can approach the subject. One is exclusively for your prof exam. The second is for your PG entrance exams or to satisfy yourself. To satisfy yourself in the sense, at the end of reading a chapter, you will have a confidence, whatever be the questions coming from that chapter, I will be able to solve it. I will be able to solve the MCQs. And of course, more than all this, above all this, I know what are all the concepts clearly. And I have tried my best to read each and every topics from the chapter. I have not even skipped any topics from the chapter. So in this session, I am purely going to tell how you should read for the pathology theory exams. Okay? Yes. So remember, as far as path theory exams are concerned, you should know some important steps. You can train or you can follow these tips while you are sitting for your preparation for your internal assessment, okay, for your IE or for your upcoming model exams or whatever it may be. You can follow these tips. So, without much delay, I am going to start. First, which question bank you should follow? My sincere advice, please don't follow any old question bank, because you are following the CBME curriculum. You are following the competency-based medical education curriculum. As per the CBME curriculum, as you see, if you have gone through the last year's 2019 batch question paper, all that means whatever the questions they have asked, all these are case-based or case scenario-based questions. They are more clinically oriented questions. So, please don't follow any of the previous years, that means the question bank that our seniors used to follow. Because you won't be able to, if you study those questions, you won't be able to answer properly in your final prof exams. Okay, so please don't follow old question bank. Please don't follow. Then what question bank you used to follow? Recently, many medical colleges, they have started producing or they have started preparing question bank based on your latest CBME pattern. That means with clinical case scenario based, okay, and even in short notes, the pattern, okay, the earlier trend of questions has been completely changed. Even in short notes or in essay, whatever it may be, they are asking purely case scenario based questions. Fine. So please don't follow any previous or old question banks. But what you can do? Yes, what you can do? You can go through the previous year MGR University question papers, that too essay part mainly. Why? Because in essay they have given lot of case scenarios. If you see, from 2004 to 2020, you will get lot of questions, clinical case scenario based questions in our MGR University website. You can download those question papers, you can use that as a reference. But still, don't even believe that, because CBME curriculum, the pattern has been completely changed. You are going to get a different pattern of the questions. You are going to get a different pattern of the question. So please don't trust any question bank. Any question bank. Fine? Yes. Fine. So that is the first question. Next. With the help of some postgraduates and some faculties, I have tried to prepare a question bank exclusively for CBME batch, CBME curriculum, with clinical case scenarios. Tried my level best to cover almost all the topics in Robbins. Fine. Latest updates, questions from the 10th edition of Robbins has been included. Then multiple choice questions also we are preparing. And the greatest advantage is clinical case scenario based question. Clinical case scenario based questions. You can either WhatsApp me at this number or at my Instagram page. You can get chapter wise questions. Okay, right from the first chapter I have been uploading the questions, short notes, essays, MCQs, everything. You can text me in this number, or you can go through my Instagram page which I have mentioned here, and you can get all those questions there itself. But still I am telling, even don't trust my question bank, because you know, as per, if you are analyzing the last year's question paper, unless and until you try your best to read all the topics, okay, of course common questions are common, common questions are always common, but still I will give you a very good advice. Please try to read something about everything. In every topic you should have an idea. You should have an idea. It is not like that you should know each and every point in that. No. Suppose if they ask you, usually what? Apoptosis or necrosis will be asked. But recent years, last year and before last year, from my batch onwards, they have started asking necroptosis and pyroptosis. Remember, when I am studying, we will be following 9th edition. In 9th edition of Robbins, necroptosis and pyroptosis are not that much explained. But in 10th edition, very beautifully with a diagram, okay, they have explained about necroptosis and pyroptosis. Now we have also pheroptosis. So all these are the recent updates. Definitely you can expect these questions, okay, in your question paper. Fine, they will give, write a short note on pyroptosis. Okay, they will give like that. Or necroptosis or pheroptosis. You should know to put a diagram. Okay, because that diagram is very, very important. I will tell soon how you should write, how you should present your answers so that you can score excellent marks in your pathology theory exams. Okay, so if you want the question bank, chapter wise questions with short notes, everything, okay, care has been taken to include all questions. And remember, we are mainly, the questions are framed mainly with by taking into account the clinical aspect of the topics. Fine? Yes. Okay. Next. Fine. So, how to prepare for the long answers? Long answers. So, please, whatever, suppose if you are following the MGR question papers, or suppose you are following the questions that I am posting, whatever it may be, the long questions, that means the essay questions, you have 2 essay questions, 2 into 15, that is for 30 marks. Fine? Yes. For example, this is one of a very, simple question. This is how they will, give you a case scenario. A 50-year-old male comes to OPD with complaints of evening rise of temperature, hemoptysis, productive cough, sputum examination reveal, rod-shaped acid fast vessel. What is your most probable diagnosis? And please, in 15 marks essay question, 90% of the time you will have lot of sub-question. The examiner don't want you to simply write any stories. Fine? They will clearly test whether you know the subject or not. See, what is your most probable diagnosis? So, a student who don't know the clinical features of tuberculosis cannot answer this question. They can't, okay, they can't answer this question. Am I right? They can't answer this question. They can't answer this question. They can't answer this question. What is the most probable diagnosis? Answer is tuberculosis. What is the underlying pathology? So usually in earlier times they will ask, okay, write in detail about granulomatous inflammation. Now they will give a case scenario. Tuberculosis is a classical example of granulomatous inflammation. They will ask you what is the underlying pathology. Answer is granulomatous inflammation. Explain in detail about the various events in the same. Okay, sometimes they won't even mention, they won't even give a hint to that it is a granulomatous inflammation. Okay, here in the next question in subset C, I have given that it is chronic inflammation. So with that itself, and most of the times remember there will be some hints or clue within the question itself. In the sub question itself, we can find the diagnosis and explain in detail about the structure of granuloma. Remember now in these days, structure of granuloma, then what? Structure of different types of giant cell. These are some of the examples I am speaking pertaining to inflammation. The same thing applies to all topics. Okay, some of the important structures, we have a lot of appearance, Zamoma bodies, bread and butter appearance. Okay, we have a lot of orphan annuli nuclei, papillary carcinoma of thyroid. We have lot of appearance and histopathological findings. So sometimes they will ask you to draw the structure. So you have to carry hematoxylin eosilin pencil. Okay, you have to carry hematoxylin eosilin pencil and you will be asked to draw the structure of granuloma. So the 15 marks will be split up, okay, for your diagnosis. You have to support your diagnosis. Don't simply write it is TB. Okay, since your friend who is sitting near me have told you the answer is TB, don't write it. You have to support. Yes, the patient is what? Even a rise of temperature, hemoptysis, product takeoff and sputum examination is acid fast bacilli. So all these characteristically suggest a tuberculosis. So that you have to support. For that you will be awarded some 3 marks. Okay, then next, for what is the underlying pathology, another 3 marks. Now itself 6 marks. Then for another some 7 marks, okay, will be for in the chronic inflammation. Chronic inflammation, we have different pathways of what macrophage activation, right? We have granulomatous inflammation. Okay, what is the pathogenesis? Everything we can write a lot. And finally for some 2 marks, for the structure of granuloma, you have to draw it beautifully and you have to label it properly. So this is how. So how to prepare for long answer. So this is one example. In one chapter, for example, inflammation, they will give what granulomatous inflammation as an essay. Sometimes they will give you what in immune system, they will ask different types of hypersensitivity reaction. In each type of hypersensitivity reaction, don't expect. Earlier they used to say, okay, explain in detail about type 1 hypersensitivity. No, now what? A 16-year-old boy comes with the chief complaints of what? Sweating, vasodilation, sweating, flushing, erythema. Okay, and the patient has a history of exposure to that of the pollens. Okay, he was playing with his friends and he accidentally get exposed to that of some of the pollens or dust allergy. What will be the pathology? So pathogenesis, probable diagnosis. The answer is type 1 hypersensitivity reaction or allergy. What is the? Explain in detail about the pathogenesis. Give some other examples of a type 1 hypersensitivity reaction. This will be the sub question. So whenever you approach, so from your university question papers or from the question bank that I am posting, you will have an idea what are the essay questions that may probably be asked. Am I right? Yes. That they may probably ask. And in such a case, remember how you should approach that question. Okay, how Robbins will help, I will come to this. Before that, I am going to tell you how you should approach such question. For example, see, this is an inflammation chapter. So, in inflammation chapter, okay, we have what? Yes, chronic inflammation. In this essay question itself, I am taking as an example. In chronic inflammation, what all you have to write? Okay, what all you have to write? See, please, in chronic inflammation, you should know first what are the causes. As those students who are using Robbins, see, Robbins is very beautiful. Okay, why? Because and at the same time, it is very easy to write elaborately for your prof exams, because if you just remember the headings, okay, I'm going to write the headings in a bold color. See, causes of chronic inflammation: persistent infection, hypersensitivity diseases, prolonged exposure. So these 3 points, if you mention itself, so just go through the headings, because at the last time it is not possible for you to go through each and everything. For example, tomorrow you are having 3 chapters internal assessment. It is not possible to sit and read each and every. So focus on this. You should know what all headings you should write. Causes, morphological features. Then what are the mediators? In role of macrophages, definitely when the macrophages come, you have to write the 2 classical pathway. We have a classical activation and an alternate activation. Please follow this flowchart. See, Robbins is very beautiful, because if you just mention the headings, not even the content, if you just mention the headings and if you go through these flowcharts and if you reproduce these flowcharts, they are definite. A good examiner, okay, will definitely give you excellently good marks. Unlike the first year exams and all where the number of pages matter, I am telling again and again, the pages and all are not going to fetch any marks. Okay, just content. How you are presenting the answer. Chronic inflammation means these are headings the examiner will expect. And finally, okay, you can structure of granuloma. You can draw the structure of granuloma. Fine. Then finally, you can write about the morphology, epithelial cells, giant cells, granulomatous inflammation. And see, we have lot of examples of granuloma, tuberculosis, leprosy, syphilis. In each of these, what will be the time? So depending upon the time, so time management is very important because you don't write what a lot of pages. What they have as chronic inflammation means what? You should write what is the causes. Then what is the mechanism, okay, what are the two pathways of macrophage activation with the morphology. And remember, as far as pathology is concerned, you should write about morphology. So usually we will say whenever a question has been asked in pathology, for example, now we have not started systemic pathology. When it goes for systemic pathology, sometimes they will ask you teratoma of ovary. So when they ask this question, what are the things you have to write? Number one, you have to write what is the etiology. Just headings. The examiner will see whether you have included this heading. In etiology, you can write some 3 or 4 points. Then number two, what is the pathogenesis? How this occurs? How this teratoma occurs? Number three, you have to write morphology. And remember, in morphology, what are things A and B? A is nothing else but the gross findings. B is nothing else but the microscopic findings. Fine. And 4 clinical features. Yes, 4 clinical features. This is the point where I have to stress on. Earlier, we used to skip reading clinical features. But now, without these clinical features, you can't come to the diagnosis. When you are reading granulomatous inflammation, in Robbins, it will be very beautifully mentioned. How the patient presents with. Like I have told you as an example of tuberculosis, how the patients present. So please, for all the condition, for shock is a very standard essay question. You should know how to differentiate between features of a septic shock or a hypovolemic shock. Okay, there are some characteristic clinical features. Okay, then you should know what are the clinical features of tuberculosis. You should know what are the clinical features of leprosy. Whatever question in systemic pathology, we have innumerable number of cases. Any question, unlike the earlier, only myocardial infarction will be asked as an essay. Nothing like that. Any question can be asked as a short note as well as an essay. The apoptosis, which is usually asked as an essay, can be asked as a short note also. Sometimes they may even ask what necroptosis, pyroptosis in the form of sub-questions in the essay questions. Fine. Yes, anything can be asked. So, how the patient presents. So, please, wherever you came to know in all the long answer, please go through what are the clinical features, because it is this clinical features which is going to help you to get the correct diagnosis. Remember, in the essay question, the first sub-question will be always what is your diagnosis. And I am telling you, if you go wrong with the diagnosis, that's all. You are done and dusted. Fine, 15 marks. No way, because if you answer the first, the diagnosis, the first part itself wrong, the rest of the part you can't manage. There won't be any hint, okay, in the sub-questions, you can't write. How you write? What is the probable diagnosis? If your diagnosis is wrong, how will you write about the pathogenesis behind it? Each of the disease conditions have different pathophysiology. Am I right? Yes, the mechanism is completely different. Then how you can manage? You will be done and tested in one essay, 15 marks gone. Okay, so please, whenever you approach such long questions, whether we are following my question bank or whatever, the university question bank, in those questions, make sure that you are reading all the headings, especially the clinical features. If you do like this, please, I am telling you can answer any type of short, long answer question. Fine. In each chapter, you can go through the previous year question papers, or in my question bank, I will be clearly mentioning whether that is VVIP or very important. It is a must to read. In some chapters, there are some questions called as must read questions. That means without reading that question, you please don't go for the exam. You will get nicely. Okay. Yes. For example, in cell injury, you should know all apoptosis, necroptosis, then pyroptosis, ferroptosis, necroptosis. All you should know. Inflammation. Acute inflammation is a standard. They will give you. They won't give you. Earlier they used to say explain in detail about events of acute inflammation. Now what they will give? A patient with appendicitis, McBurney's point tenderness. That is why everything is very beautifully mentioned in Robbins. In clinical features itself, they will have very beautifully mentioned. So if you get that clinical feature, first you will find the diagnosis. Yeah, it is acute appendicitis. So acute, that means it's acute inflammation. So the examiner wants us to write about the events in acute inflammation, outcomes of acute inflammation, mediators of acute inflammation, everything. Mediators of acute inflammation is a separate essay question. So anything. So you should be ready to what? Answer any sort of questions. So I hope that is clear for you. Yes. Now comes the question, how the Robbins is used to help. I am telling Robbins is the best book for pathology. Whether it is for PG, okay, for your postgraduate, any type of entrance exam, or for your prof exam. Now I am going to talk only about the prof exam. In prof exam, first thing, just read headings. Those who are studying at last minutes, read the headings. Number 2, diagrams. Pictures. Number 3, flowcharts. I am sure if you have gone through these 3 things in Robbins, for example, I told you, chronic inflammation, Robbins very beautifully, the author has mentioned the causes, the morphology, the pathways or the mechanism in the form of flowchart. Just focus on that pictures. Then granuloma structure, everything very beautifully mentioned. Examples, you can always focus on the tables. Just remember, yeah, leprosy, syphilis, cat's crush disease, fine. What are the types? Okay, cat's crush, stellate granuloma. If you just write the points, that is more than enough. If you follow Robbins, definitely you can score extremely high score. Should I read every topics? The answer is a big yes. Why? Because any question can be asked. Now you are having time. I request you all, please make sure that you read something about everything. Something about everything. Suppose if they ask you for a short note question, ferroptosis, but you don't know the mechanism of ferroptosis. Okay, of course, only a small paragraph is there. The examiner will also expect you to write. They won't expect you to write 2 pages, 3 pages. Essay means 15 pages. Nothing like that. Crisp and precise. The question will be very, very specific. Question will be very specific. Very, very specific. If they ask you to write about outcomes of acute inflammation, write only outcomes. If they ask you to write about systemic effects of inflammation, in Robbins beautifully 3 pictures will be given in systemic effects of inflammation. I will show in this. I will show in this in the systemic effects of inflammation. Okay, I think it's not. Okay, see, outcomes of acute inflammation. See, very beautiful picture they have given. Very beautiful picture. Draw this picture. That's more than enough. Draw this picture. It's more than enough. Okay, see. Then they ask you macrophage activation pathway. Draw these 2 things. That's enough. It should be will be very crisp and precise. So suppose if you don't know the answer, we will do one phenomenon. What is that called as? Cooking up. We will write our stories. What we know about inflammation. Suppose if the question is outcomes of acute inflammation. Yeah, I don't forget. I remember outcomes of acute inflammation at that time. Fine. So what we will write? I will write about what? Patterns of inflammation, serous, fibrinous. But that's not the examiner has asked you. Okay, that may happen in 1 or 2 questions. But if that occurs in all questions, no, you will be done and tested. Okay, the question will be highly specific. It's not like the previous year. I'm repeating again and again. So please try to read every point. Should I read every topic? The answer is a big yes. You should read something about everything. When somebody asks you outcomes, you should know the 4 points at least. And you can further elaborate with your skills and all in what you can fill up the pages. Please use diagrams. Should I focus on clinical feature? The answer is a big yes. I have already told you should focus on clinical features. Okay, you should focus on clinical features because your diagnosis depends upon how you read about the clinical features. How to score good marks? Answer is simple. Write one and only points. Number 2, present neatly. Number 3, follow proforma. What is a proforma? When a question is asked, whether it is a short note or an essay, first write, if a case scenario is given, first write what is your diagnosis. How substantiate your diagnosis. Mechanism, etiology, pathogenesis, morphology, gross, microscopy, clinical features. If you have time, you write, otherwise no problem. Then 4, diagrams and flowcharts. Robbins diagrams and Robbins flowchart, that will give you always extra marks. I am telling you, I personally studied only Robbins. Even though it was very difficult in initial time, that was the only book which helped us to revise very quickly within a very short period of time before your university exam. One full textbook you have to study within one day. It is not possible to sit and revise. Okay, today morning you will have exam. Tomorrow afternoon morning you will have another exam. No gaps between you. Paper 1 and paper 2 in pathology. Usually, unless and until it is a second Saturday or Sunday. So you won't get time to sit and revise each and everything. I'm telling you. But in Robbins, and while you are reading Robbins, I told you how you should read Robbins. You can go through my YouTube videos, how to read the textbook of Robbins. But I am again telling, please just highlight. Don't highlight each and everything. Don't highlight everything. Just highlight the important headings, important points that you may forget. And please star the pictures and diagrams that you should focus before your exam. Okay, be crisp and precise, everything. Each heading, if they ask you, inflammation means you should have a picture. You should have your own idea, what are things I am going to write on that. Fine? Yes. Write points, neat presentation, follow the proforma, that is the way you are presenting your answer, diagram and flowchart. You can get excellent score, trust me. How to manage MCQ question? Start solving any MCQ bank. But remember, the question pattern, the MCQs that they are asking in our university, it is purely from Robbins. If you are reading your theory parts, in depth, okay, read in depth, you can find answers to all questions. Robbins, it's more than enough. Okay, the bold letters in Robbins. And to know whether you know the things or not, you can practice anything. Again, you can ask me, you can text at me 70124600. So this is my WhatsApp number. You can text me. I will be giving around 930 questions are there with me. Okay, the full pathology, around 1000 questions are there with me. Each chapter we have some 50 to 60 questions for your practice. You can practice the same question again and again and again. So it will be very simple question only, straightforward questions, but it will be a bit tricky because at last when you study the 2 volumes of Robbins, you will forget, you will go wrong with the very basic questions and only at last you will be answering only the very difficult, rarest of rarest question, but very simple basic question you will go wrong. Okay. So I hope things are very clear for you. Yes. So please watch this video, please follow as per what I am telling, and please plan yourself and study. Planning is very important. Okay, please plan yourself and study. Okay, please plan yourself and study. This is very, very important because unless and until you have a planning or you don't have what you are going to do, you should have an idea about it. Without having an idea, the result won't be that fruitful. So similarly, while preparing for your Prof exam, right from now, okay, you are still not late. You can start. You have a lot of time. Each chapter, previous year, okay, if you are following any question bank, go with it. But prepare with this so that even though you are following any old question banks, you can correctly find the diagnosis. You can correctly answer all the sub questions in essay questions as per your new CBME curriculum. So hope this session have been useful to you all. Thank you. Okay, please, Robbins or whatever books you are, Hashmohan or Ramdas, whatever books you are, please make sure that clinical features, the diagrams, flow charts, so that at last you will be able to present all this properly. You can get excellent scores. All the best and thank you.